Hello, and welcome to this video where we will be discussing the concept of infection with the exemplars of Hepatitis A virus, Hepatitis B virus, and Hepatitis C virus. My name is Abigail Winowich. I am a UNM student in the Master of Nursing Science, concentrating in education. We will go over the etiology, pathophysiology, clinical manifestations, including discussion about labs. We will discuss complications, nursing collaborative care, and related concepts, all concerning hepatitis A, B, and C. The objectives of this video are to: by the end of this session, you should be able to differentiate among different types of hepatitis and corresponding risk factors, differentiate among the types of hepatitis, including etiology, pathophysiology, clinical manifestations, complications, and nursing and collaborative care interventions. There are two really nice infographics which go over different types of hepatitis. These infographics were developed by the World Health Organization. I'll just show you those briefly, and then I'll include a link to those in the information section of this YouTube video. This one's interesting because it shows some information from the World Hepatitis Summit from 2015, which was in Scotland. Okay, let's get started. Okay. Hepatitis A virus is transmitted through feces, bile, and sera. However, the most common route is through the fecal-oral route, usually because of crowded and unsanitary conditions, especially related to food and water. Prevention includes a vaccine, which is the HAV vaccine, as well as through the combination of an HAV vaccine and an HBV vaccine. But the best way to prevent HAV is through hand washing and, of course, through wearing gloves when in contact with fecal matter. Hepatitis B virus is usually transmitted through blood to blood contact, as well as through sexual contacts. Your chances of developing hepatitis B vaccine or contracting the virus is by being immunosuppressed, so immunosuppression, through receiving hemodialysis, through receiving multiple blood transfusions, through multiple sexual partners, through sharing needles, and syringes and any other drug equipment, as well as infants born to infected mothers. There is, as we said before, a hepatitis B virus vaccine, which is important in multiple ways. It prevents transmission. Prevents transmission, but it also reduces the risk of hepatocellular carcinoma, which is cancer. Okay, so it reduces risk of cancer. So in the future, when we refer to the word cancer, for the sake of this video, we will be concerning our, let me rephrase this. When I say cancer in this video, I pretty much only mean hepatocellular carcinoma. Okay, now to hepatitis C virus, which is probably the one you've seen or heard of most commonly. About 40% of people with hepatitis C virus got it from IV drug use. And furthermore, most people who have hepatitis C virus and are IV drug users also have a very high risk of having HIV infection. So that's a combination, a co-infection of hepatitis C virus as well as HIV infection. There is not a vaccine for hepatitis C. The reason behind that is that there are a lot of variants in the virus, and also there's a strong resistance to drug therapy. Pathophysiology. Both of the pathophysiology is the same for each of the viruses, okay? Cell injury occurs because of 3 different cell-mediated immune mechanisms. The first is through cytotoxic T cells. The second is through T regulatory cells. And the third is through natural killer cells. All of these cell-mediated immune mechanisms cause problems to the cells of the liver, including necrosis, scarring, Kupffer cell hyperplasia, and mononuclear phagocytes. All of this can lead to obstructed bile ducts. Obstructed bile ducts, obstruction, leads to, as you might have guessed, in the liver, let's get this color, cholestasis, which leads to obstructive jaundice. Okay? So when we get to complications and discuss some of the clinical manifestations, we will discuss jaundice. So, clinical manifestations. On this section, we'll discuss symptoms and assessment findings, as well as the laboratory results you might see in someone who's infected. So, symptoms include fever, fatigue, decrease in appetite, nausea, vomiting, abdominal pain, and joint pain, as well as before seeing jaundice, you would see a darkening of the urine and clay-colored stool. Typically, jaundice is a late sign, but you also might see some things in your assessment, like a painful abdomen upon palpation. And percussion. There might also be a residual right upper quadrant pain, even after some time, even after the acute phase is over and the person is no longer displaying symptoms. And a weight loss of 2 to 4 kilograms is not uncommon. However, it's important to realize that some people show absolutely no symptoms at all. So this is where we might look at the laboratory values. There are abnormal liver function tests. So there's an increase of serum aminotransferase, as well as AST, which is sometimes called SGOT, so don't be confused if you see that, and ALT. Okay? The normal for AST for males is 10 to 40 international units per liters. And females, it's more common to see 9 to 32 international units per liter. Those are the normal values. So you would see an increase with someone who has hepatitis. As for ALT, the normal values for males is 29 to 33 international units per liter, and for female, 19 to 25. So again, these are the normal values. However, with hepatitis, you would see an increase. Let me scoot that up so you can see it a little better. You might also see an increase, like we said before, increase in bilirubin. And you'll see this most commonly during the acute phase. Bilirubin's normal value is about 1 milligram per deciliter, but during an acute phase, you would see it as high as 5 to 10 milligrams per deciliter. Okay? Now, typically, all these LFTs return to normal in 2 to 12 weeks after the onset of jaundice. So jaundice is a good indicator of the disease process. Okay, so we said earlier jaundice was a late sign or late symptom. However, LFTs can return to normal 2 to 12 weeks after the onset of jaundice, unless it's chronic active hepatitis. And back to some symptoms, information about symptoms. This is something I meant to mention earlier. There is a full spectrum of symptoms. Some is absence, like we said. Some people have no symptoms at all. While here on the much further spectrum is something called fulminating hepatitis, which is most common with hepatitis B, although it is rare. It leads to massive necrosis. And with massive necrosis comes a rapid onset of liver failure and coma. So that's over here with the fulminating hepatitis. Some forms of hepatitis B and C virus can cause nephritis as well, and you also might see ascites. So those who are visual learners, ascites, nephritis. Those are also some things you might see. Apologize for the mess. So, there are some complications. Cancer is one complication that is found in both B and C, hepatitis B and C. And cirrhosis is seen in B and C, especially in people with hepatitis C who also have HIV. Now, cirrhosis is one of the most common risk factors for cancer. So, these are both complications and they're both related. Other complications include chronic hepatitis, that's seen in both B and C, and again, especially in C with people who are co-infected with HIV, as well as chronic liver disease. And that's in mostly C, and it's honestly very high at about 80% of people who have hepatitis C have chronic liver disease. And let's go back to that, what we were saying earlier about fulminating hepatitis. Like we said, that's most common with B. It is rare, but it causes major necrosis, which can cause encephalopathy. Encephalopathy is most commonly seen with symptoms of confusion, stupor, and a coma. But with chronic liver disease and other liver issues caused by hepatitis, we also see liver failure. And I know you'll be discussing this in some of your modules for this week. Liver failure can lead to GI bleeding, cardiorespiratory insufficiency, as well as hepatorenal syndrome. So, let's move on. We're getting close to the end. The nursing and collaborative care interventions for this include nutrition. Nutrition encourages a low-fat and high-carb diet. We also encourage healthcare providers and family members to have no contact with blood or body fluids. We encourage prophylaxis in the form of vaccinations, as well as vaccinations for people who have liver transplant. One major resource for those who are interested in hepatitis care is through UNM's Project Echo. UNM's Project Echo was started, their first Project Echo was started through hepatitis care. But another thing that I think needs to go into this module is providing culturally competent care. That means a lot of people who have hepatitis C especially are IV drug users. And this is a very stigmatized and marginalized population. It's important to still use empathy, advocacy, safe care. This is nursing needs to be a judgment-free zone. Okay, and finally, let's conclude with some related concepts. So, some health and illness concepts, as we discussed, were infection. That is what these exemplars are. Close with infection is inflammation, which is common in hepatitis, as you would see from the root of the word. But also related to these are nutrition, tissue integrity, and sexuality, immunity, and stress and coping. All of those things go together well with infection, especially for hepatitis. There are some professional nursing concepts and healthcare nursing concepts that align well with the care of someone who has hepatitis. That's safety, patient education, health promotion, health disparities, and care coordination. So, I will conclude this video, and I thank you for your time. What I would like you to do is check out the links to those infographics we looked at the very beginning of the video, but also I will include resources and references for where I've gotten the data for this lecture. Thank you for your time.